Hey everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about the treatments for esophagitis, which is seen quite often in people who have both Lyme and Bartonella, but also in patients who simply have Bartonella. For some particular reason, that area of the upper GI seems to attract organisms that can really cause quite a bit of damage and quite a bit of harm. Largely what I'm talking about is the area just above your stomach. Just above your stomach is the lower esophageal sphincter. And then typically people will tell me that they have severe GERD or they have esophagitis sort of maybe up until their mid-breastbone. Mid-sternum. And I am very familiar with this because this is one of the symptoms that I had when I was in the great throes of Bartonella treatment. And I can tell you that one of the best ways to sort of heal upper GI issues is using deglycyrrhizinated licorice and aloe. And you can get aloe as a drink liquid, and it will be thick and gelatinous, but it's very, very nutritive to the GI mucosa. So you can drink aloe every day and take DGL. That's one way to help. That will help, but that only helps really sort of a more mild form of esophagitis or upper stomach issues. Another thing that you can do is take Iberogast. That stuff is just amazing, and you can get it on Amazon. Iberogast, Iberogast. It's a German. I would say it's a German herbal combination, and you can take 10 to 20 drops 3 times a day, and generally everyone gets relief from their GI symptoms, upper GI symptoms, when they take Iberogast. Generally, the best way to take Iberogast is on an empty stomach, but it's an amazing, amazing supplement. The last things I want to talk to you about are the things that I do personally every day. I do peptide injections of BPC 157. I do oral capsules of BPC 157. I do 2 a day. I do vagal nerve stimulation with a vagus nerve stimulator. It's called TVNS, and you can purchase it on vegas.net. It's $299. And I do that for 20 to 30 minutes in the morning. It clips onto your ear and it sends a signal down to your vagus nerve, and it helps re-regulate your vagus nerve. The last thing that I do religiously every day is I do 20 minutes of red light laser, not red light laser on pretty much from my upper stomach to the mid of my sternum to help lower the inflammation from that area. And I do those things every day, and my inflammation has dramatically decreased. So I'm not suggesting that you do all these things. I know I'm a little bit over the top, but I don't like these symptoms. And so the best way for me to handle that is to figure out what works for me. And what works for me is BPC 157 peptide, red light laser therapy, and vagus nerve stimulator. Those things seem to calm my esophagus way down. And then if I've eaten something that has tomatoes or one of the nightshades that irritates my esophagus and stomach, that's when I'll have a DGL and drink aloe. So I hope this information has helped you, and I hope you have a wonderful day. Take care.